I'm Dr. Mohibullah Wazir, and we discuss the types of the anastomosis of the vessels. We told that anastomosis will be between the arteries, and veins, or arteries and veins. Now, first type is the arterial anastomosis. That is anastomosis between artery and artery. It is of two types. Number one, actual arterial anastomosis, and number two, potential arterial anastomosis. In actual arterial anastomosis, what happens? Look, one artery comes and get anastomosed with another artery, or a branch of artery comes and anastomosed with a branch of the artery. So that if this artery is being closed or obstructed over here, then the blood will come through this collateral circulation to this organ or viscera, and the organ or viscera will not suffer. In this actual arterial anastomosis, a good collateral circulation is being maintained by anastomosis of the artery to artery or a branch of artery to artery. While in potential anastomosis is there, but it is at the level of the terminal arteriole, not at the level of the arteries. But at this small vessel over here, at the level of terminal arterioles, there is anastomosis. So these are small vessels. If this artery becomes suddenly blocked, then these terminal arterioles will not be able to give sufficient supply to the organ, and the organ will get infarct or necrosed because of loss of blood supply. That's why this anastomosis, such type of arteries in which the anastomosis is the terminal arteriole, they are also called as and arteries. Now, but if the anastomosis, if the artery is getting blocked slowly and gradually, then the arteriole also dilate slowly and gradually. By the time that the artery get completely blocked, the arterioles are being dilated enough that it will give the proper blood supply to the affected organ. In a slow blockage, it will not infarct. And this good example is the anastomosis between the coronary arteries of the heart. While the acute anastomosis is a lot of in the body, for example, superficial palmar arch, arterial, anastomosis around the elbow joint, anastomosis around the knee joint, while over here it is the coronary arteries of the heart in which there is potential anastomosis. And then there is the venous anastomosis. In venous anastomosis, look, the vein get anastomosed with the vein, or the tributaries of the vein get anastomosed with the tributaries of the vein. And this is being put over here. For example, you see this dorsal venous arch of the hand or dorsal venous arch of the foot, in which the vein anastomosed with the vein. And then is the arteriovenous anastomosis. Arteriovenous anastomosis are also called as arteriovenous shorts. Look, these arteriovenous anastomosis, note the point. This is, look, this is one artery and this is one vein. Now the artery divides into arterioles and then into capillaries, and then the vein from these capillaries get the blood through the venules, and then the collaterals. Ultimately the blood comes from the artery to the terminioles, to the arterioles, to the venules, and then to the vein. But in some organs, for example in the skin, in the tip of the fingers, and in muscles, what happens? There is a direct channel from the artery to the vein. From the artery to the vein, there is a direct channel. Now, if the organ which is being supplied by this artery, if this organ is at rest condition and it does not need more blood, then what happens? That the blood do not pass through the capillary bed, but directly, because this organ or this muscle do not need more blood or nutrition, already sufficient in it. That's why the blood passes directly shunted from the artery to the vein and then go back to the venous system. But if this organ or muscle is in exercise condition, then the blood instead of going to this shunt will be blocked, and the blood will go through the capillary bed so that to give oxygen nutrition to this organ, and then it will come back to the veins through the capillary bed. Now these capillary beds are being present in the skin, in the tip, and in the tip of the fingers over here. They are small specialized type, where we also called as glomera. Glomera are small specialized type of arterial shunt present over here. Okay, once another type of arteriovenous shunt is called as preferential thoroughfare channel. Preferential thoroughfare channel. Preferential thoroughfare channel is again an arteriovenous anastomosis, but what happens that there is present a capillary bed around it. Normally, some people say that this are the typical arteriovenous shunts in which the blood passes through the capillary bed as well, or directly from the artery to the vein in time of rest condition. These are called as preferential thoroughfare channel. But another group says that the preferential thoroughfare channel are being differentiated from narrow arteriovenous shunt, that it is having a capillary bed at the sides. Then we also make in some, for example, in renal failure, in the case of renal failure, kidney disease, we make the arteriovenous fistula, that is make the radial artery and radial vein